Hi guys, it's Dr. Bailey again. So I'm going to go back. I know we've been kind of talking about different things, but anxiety is really big right now in our patient population, and I know that we're having kind of some anxiety emergencies. So if you are a parent with a young child, age 3 up to 21, it doesn't matter how old your child is, I need you to know that we do hear you and it is an issue, okay? So this is what I kind of want you to do. So in our practice, we've dedicated time to mental health because we know that it's so important. And rather than kind of stigmatizing mental health, we normalize it. So how do we do that? So for all of our patients that are essentially 12 years and up, we do a depression screen along with some other screeners as well, and it's just part of the visit. We have our patients fill it out, but the reason why we do that is we can kind of gauge how they are and how they're feeling at the time, and whether what they're feeling is more acute and needs further treatment or not. And if it is more acute, I always tell my patients, there are a lot of kids feeling this way. I try to normalize it. I'm not, again, making it seem like it's not important, but just telling them that they're like a lot of other kids, and like a lot of other kids, we get them into counseling, we start talking about their feelings, but we move on so that they can actually get the treatment that they need. And it's very important. So I have a screener, okay? It's a standard screener, and I'm sure a lot of the pediatric practices in your area have them, but if they don't, it's something that's called a PHQ-9, okay? The reason why I love it is it's just a little assessment. It takes 5 minutes, maybe 10, but essentially your patient can fill it out, or you as your child can fill it out, and it gauges how they feel. So you as a parent, when you go to your doctor's office, may have 5 or 10 little questions, just something quick, asking how you feel, most days, things like that. That's a screener. My thought is that this actually needs to be for kids as well. And I will tell you, especially during the pandemic, and if there are acute cases where I'll have a young person come in who's younger than 12, we still kind of give the assessment and then again talk to them. In some cases, talk to their parents as well, because their parents are nervous as well about everything. When they're 12 or up, it's more confidential, essentially, depending. So, but even still, we make sure that patient gets the care that they need. So, that being said, I do want you to make sure that your pediatric office has a mental health screen of some type and starts incorporating that in. If they do not, maybe you want to find a practice that does have that, because it is especially important in this day and age. We're seeing too many kids with anxiety, with depression, and the thing about it is this: it's hard to tell who is depressed. The ones that get me are the kids that come in, they're smiling, they're laughing, so polite. But then when you get into it, like if they're doing the screener, it shocks me. They may be close to being suicidal or have attempted suicide. And when I talk to them about it and say, why aren't you saying anything? They're just like, well, because I'm supposed to be happy. I'm supposed to go through this. So again, it's hard to know who's depressed, right? And if somebody is depressed, they're not just going to be like, hey guys, I'm depressed. So again, an assessment is a great conversation starter, because what it does is it gets those kids to start opening up, right? In a non-judgmental way. And like I said, I do always try to normalize it, not to just say that it's frivolous, but again to let them know that their lives have meaning and value, that I care, and then I let them know that their parents care and that we're there to help them. I let them know that they do have a network around them and that they're supported regardless, because there's nothing more isolating being depressed, having anxiety, and feeling alone. So again, I hope this helps. Remember the questionnaire, remember that assessment. You can always ask your pediatrician about it, but it is so important that that becomes part of the routine, so that you're not just having to call your kid out and say, hey, are you depressed? I mean, they're likely not going to tell you guys. They're just likely not going to tell you. So if they can go to a place that just has the screener, they answer those questions, they're in a safe environment, that's how you want it done. And the ultimate goal is to get your child the help that they need. All right, I hope that helps. For more information, please go to our website, www.askpeds.com, and check out our YouTube, TikTok channels as well. All right, take care.